FDA put out a warning about microneedling radiofrequency. I'm Dr. Melanie Palm, a board-certified dermatologist, a fellowship-trained cosmetic surgeon, and I'm also author to over 50 articles and a clinical investigator to over 60 FDA trials. So I'm going to break down my opinion. In this FDA warning, they've talked about some of the risks that we know about if we're developing too much heat and energy into the skin. And so some of the call outs from the FDA was that you really should have somebody operating this that understands the actual device and its capabilities. And that's something I really caution patients about. Unlike in the state of California, there are some states that you're not required to be a medically trained healthcare professional in order to administer treatments. And I think that's somewhat concerning because somebody may not understand the mechanism of action of what the device is that they're using. There's different implications on different types of skin types. And if we are administering too much heat, it can cause change in the tissue planes and skin and tissue adhesions over time. This is concerning side effects when you have somebody indiscriminately using these treatments very deeply and pulse stacking, creating too much energy and too much heat in an area. It can really cause tissue changes that are not advantageous for the patient. So I think questions to ask your provider: what is this device? How does it work? What are complications? Have they seen complications? If they have had complications, how have they treated it and has it been successful? If they are answering questions that you don't feel confident in their answers, walk out the door and find a provider that has the proper answers to this. Bottom line from the FDA, this is a warning that the provider is right and proper energy is administered to the tissues at hand. In general, when used appropriately and at the right depth with the right energy settings, microneedling radiofrequency treatments can be extremely successful for patients.